So, you're searching for a way to look rejuvenated, maybe smoothen out wrinkles or enhance your lips. Botox and fillers are really popular these days, but are used in different ways to achieve very different results. In this video, I'll explain those differences and give you all the information you need to help you decide which suits your needs the most. Welcome to my channel. I'm Dr. Sabana. I've been a medical doctor for nearly 20 years, specialising in skin and aesthetics. I want to share all the things I've learnt on the way, the good, the bad, and the ugly of the beauty industry. So let's get started. People often get Botox and filler treatment confused, despite them being the two most commonly requested cosmetic procedures. While both Botox and fillers rejuvenate and enhance the skin, they are different procedures and provide very different benefits. I'm going to take you through those differences now, but make sure you watch all the way to the end to find out the most important thing you need to research before you start any treatment. And if you find this video helpful and you'd like me to do more, please let me know by hitting the like button, subscribe and comment below. So what's the difference between Botox and fillers? Botox is a brand of anti-wrinkle injection, and it's the one that most of us have heard of. It's also been around the longest. Although there are numerous other brands such as Dysport, Xeomin and Azalor, we've all heard of Botox. They are all neuromodulators and they work by relaxing the muscles, whereas fillers are gel-like substances injected to the face to reduce the signs of aging by volumizing and plumping up different areas of the face. How does Botox work? Botox is produced by the bacterium Clostridium botulinum. It can be injected in very small concentrations into the areas of concern. It works by blocking signals from the nerve cells reaching the muscles, so preventing them from contracting. It reduces and stops muscle movement. Less movement means it softens wrinkles and it can even prevent them, resulting in a youthful appearance. Botox results are not immediate, because it takes time for the body to start reacting to the injection. Most products take 3 to 5 days to see any improvement, but normally by day 14 you see the full results. However, Dysport has been shown to kick in within a few days. Results can vary from person to person and last between 3 to 4 months. However, some brands such as Daxxify claim to last for 6 months. So how do you feel after Botox injections? As Botox begins to work, you may feel a tightness or a heavy sensation in the treatment areas. This feeling will eventually fade within 1 to 2 weeks. Since the injection causes muscle movements to relax and slow, you may also notice differences in the range of your expressions. If done on the right patient and using the right technique, you will notice a difference in the appearance of lines and wrinkles. And as I mentioned before, muscle movement returns usually between 3 to 4 months. When I first had Botox, I was nearly 40 years old, I'm ashamed to say. I really wish I had started it earlier. You know how it is, you're in your 30s, you feel invincible. I wasn't going to age. I had great skin, no wrinkles, so what did I need all this for? And then I had my son, I didn't sleep for years, and one day I woke up with bags, wrinkles, and I felt like I'd aged overnight. So my first treatment was Botox. I had the usual 3 areas: forehead, crow's feet and glabella area. I didn't need any numbing cream. The procedure took about 10 minutes and the consultation obviously took a lot longer. A few hours after, I had a headache and I did have a bit of heaviness in my head, but this only lasted for about 24 hours. Then 2 weeks later, my results kicked in. I looked refreshed, my eyes appeared brighter, but I still had movement and it even helped with my migraines. And I've never looked back. I have Botox treatments every 6 months now. My last treatment was around 4 months ago, and as you can see, I'm getting some movement returning. I always advise my patients not to return for their Botox treatment as soon as they see small amounts of movements. The reason is Botox works by relaxing muscles, so when they're relaxed, they're not exercising, and therefore can atrophy, essentially debulk. So you don't use it, you lose it. Not using your muscles for short periods after each injection is not a big deal, but if you're someone who returns for their treatment religiously every 3 months, whether there's movement or not, then after a few years your muscles will start to thin. This then causes the opposite effect and makes you look older. So don't be an eager beaver. How does filler compare to this? As we get older, we usually lose volume. So fillers are used to add support and refill areas of volume loss. Fillers do this by inflating or plumping the skin with hyaluronic acid. Fillers are commonly used to add volume to the cheeks, the lips, and the temples. Fillers can be used under the eyes to help with the sunken appearance and even be used to upturn corners of the mouth. There are a variety of fillers on the market and based on their ingredients are used for various reasons. Hyaluronic acid based are nearly all of them and provide a hydrating and plumping effect. Some contain calcium hydroxyl apatite, which stimulate collagen production whilst also volumizing. And then there's a product called Sculpture, which contains poly-L-lactic acid. This stimulates collagen essentially by creating a scarring process whilst also volumizing. Most fillers contain numbing agents mixed with the products, so although injectors won't use a topical numbing cream, after the first few injections, the area starts to become numb. So the procedure's not really painful. So I've had Miley filler in my temples and cheeks nearly 2 years ago. I do plan to get some more treatments soon, and I promise I will share my journey with you so you can see what it involves. When you have cheek fillers done, injectors often use a sharp long needle to ensure the filler lands right against the bone. This reduces any risk of vascular occlusion. Vascular occlusion is when the filler blocks the blood vessel, and if it's left untreated, it essentially kills the surrounding tissue. By placing the filler deep against the bone, it provides a better scaffolding for the overlying muscles and fat. So when I had my cheeks done, I could feel the tip of the needle scraping against my cheekbone. It's that feeling of nails scraping on a chalkboard. Don't worry, I wasn't going to make you listen to that. Anyway, there was very little swelling or bruising after the injections. I did feel a bit bruised, but there was nothing to see. Overall, it really helped me look less tired. No one could tell I had any work done. I just got comments like, "Oh, you look really refreshed." And you know what? That's the key to a good injector. A good injector will ensure your treatments are not noticeable, but you just look rejuvenated and refreshed. So what could go wrong with Botox or fillers? There are the usual common side effects with most injectable treatments, such as bruising, swelling, redness. And just remember, just because you don't have a bruise or redness during one treatment, it doesn't mean it won't happen the next time. There are rarer side effects that can occur, such as infection or allergic reactions. This is the benefit of seeing a medical professional. It means that they can prescribe the right treatment if anything was to go wrong. Things that can go wrong with Botox is really dependent on the injector's technique. Injecting into the wrong muscle or at the wrong depth can result in things like drooping of the eyelid or freezing of the wrong muscle. The most common issue we see with fillers is filler migration. Filler migration can occur due to invasive techniques, the injector using the wrong filler in the wrong area, and can also occur with our change in facial structures with time. There are some really rare side effects with dermal fillers, and these are called granulomas. They are pimple-like eruptions that occur on the skin, and it's an inflammatory scar process. It usually occurs at the site of the injection and can occur anytime between 6 weeks from the injection to years after the injection. And it's usually linked to impurities in the filler, often seen in cheap fillers or fake fillers. It's common in patients with diabetes or autoimmune conditions. And as previously mentioned, the major risk factor for fillers is vascular occlusion. It can happen to the most experienced injector, but it's vital that the injector is able to identify it and treat it immediately. You now understand the differences between Botox and fillers. So what do you go for? To be honest, most people need a combination of both to achieve the best results. I would always recommend booking a consultation with the injector so they can discuss your concerns and create a personalised treatment plan. If you came to see me for lip filler treatment, then I may recommend getting lip flip done with Botox. As Botox relaxes the muscle, it relaxes the muscle under the lip and it stops your lip curling under when you smile. This means there's more pink area of your lip visible. You may therefore need less filler and there's a less chance of filler migration as the muscles are not moving. But this obviously would be assessed on a case-by-case basis as lip flip may not be suitable for everyone. My goal is to provide treatments that enhance your natural features and not to make you look like someone else. So, if you come in with a picture of Kim Kardashian on your phone, then I will show you the door. As an injector, it's important to address your expectations. Just remember, Botox and fillers are great anti-aging tools, but it's not surgery and it can't lift your face. It's great that you spent time researching the difference between Botox and fillers, but the most important thing to research before you start any treatment The most important thing to research before you start any treatment is to spend time finding the right injector. Take a look at these images of Mona Lisa. Would you blame the paint or the paintbrush for creating this second painting? No, you'd blame the artist, right? It's the same with injectable treatments. You can't blame the Botox and the fillers for these overfilled pillow faces. It's the injector. So do your research, visit your clinic, read their reviews, and look at the before and after images. And ideally, go to someone who's been recommended by a friend. If you enjoyed this video and found it helpful, I think you'll really enjoy this one on how to find the right injector and what red flags to look out for.